Hello, namaste, and good morning to everyone. My name is Dr. Vijay Mule. I am from Vaticanol, India. I take opportunity here to welcome you all on Vaticanol Virtual Interaction Platform. The name of this program is Veterinary Expert Speaks. This is a digital initiative designed for sharing the latest technical knowledge and updates related to the veterinary field from expert point of view. Uh, I would like to thank you, the registered participants who are joined this webinar, and also the participants who are viewing this Go Live program on timeline of Vaticanol India Facebook page. Having said that, today's topic of the seminar is repeat breeding, recent protocols in management of repeat breeding in dairy animal. As you are aware that repeat breeding in dairy animal has been always a challenging problem responsible for great economic loss to the dairy industry, and the financial losses due to the repeat breeding is increased intercalving period, loss of calf and production loss. Though our approach, field veterinarians, academician approach is to achieve the calf a year program. However, practically it is difficult to achieve as the incidence of repeat breeding in India has been reported high. The causes are of multifactorial in origin. This is the challenge related to this condition, and there is a need to understand different treatment protocol. Now, at this virtual platform, let us understand this topic from the expert point of view. It gives me immense pleasure to introduce our today's speaker for the program, who is eminent scientist and versatile personality in the field of animal reproduction. He is a renowned personality, is none other than Dr. Niteen Markandeya. I would like to thank you, Dr. Markandeya sir, for being with us for next 1.5 hours. I would like to now take you through his short profile and some of his credentials and achievements. So let us see the speaker profile. Dr. Niteen Markandeya, who is presently working as an Associate Dean in College of Veterinary and Animal Science, Parbhani, is a Master's in Veterinary Science in Animal Reproduction. He is also achieved the rank in ARS examination. He is an expert in the field of animal reproduction, gynecology, and veterinary obstetrics. He has around 32 years of experience in the field of teaching, research, and extension in Veterinary Institute. His contribution is known in national research level in the field of animal reproduction by his participation in 10 international, 37 national, and 29 regional conferences. He is a member and executive committee member of many national scientific bodies, including ISSAR. He is a referee of about 12 Indian journals in various areas of veterinary sciences. By virtue of his recognized contribution through academic research, training, and extension in the field of animal reproduction, Indian Society for the Study of Animal Reproduction, ISSAR, has awarded Dr. Markandeya the fellowship of the society. So such a great achievement for the field. Dr. Markandeya has a distinguished career in the veterinary extension field. He is recipient of several awards and recognition for his dedication and contribution for the benefit of the stakeholders related to the dairy industry. His contribution includes 900 publications in local language, 55 radio talks program, 45 media TV program, 12 Marathi published books, 23 audio video CD, participation in 150 infertility camp, 145 technical lectures for field veterinarian, 150 animal judging competitions, and 450 lectures for dairy farmer. Then I would like to stress on his recent published book on manual of gyneco-clinical cases in dairy animal. First edition was there in 2015. Is very popular book and very useful for the students, teachers, scientists, and field veterinarian. With this brief introduction, I call upon Dr. Markandeya sir to deliver his presentation on this topic. Now, thank you so much, sir, for joining with us, and we'd like to hear you for next one hour, and then followed by the question and answer to the participant. Over to you, Markandeya sir.
Thank you, Dr. Mule. Thank you, Team Vaticanol. Very happy to meet all field veterinarians who are joining this webinar. and opportunity is given by Vetaquinol to we all for interaction on a very important topic of infertility problems, that is none other than repeat breeding. Friends, we are going to discuss about recent protocols in the management of repeat breeding in case of dairy animals. So focus is on cows and buffaloes, and I will be happy to share my experience with you all. Friends, whenever an animal is reared by the dairy owner, definitely owner has some target, and dairy owner is expecting best reproductive efficiency of the dairy animals. For that purpose, the targets must be there, and owner should definitely achieve these type of targets by getting optimized reproduction in dairy animals. We expect first calving in case of cows by 20th month, whereas in case of buffaloes by 34 months. So early puberty is most important. This puberty is only possible if newborns, they have higher body weights and maximum growth rate. Then only early puberty and first calving is possible at the early date. Calving interval of 365 days is expected in case of cows, whereas it is 420 days in case of buffaloes. Similarly, days open must be less than 100 in case of cows, whereas in case of buffaloes, the days open are expected to be less than 120. Pregnancy rate, whenever we have a farm of 10 animals, at least 9 animals should calve in a year. Similarly, 9 buffaloes should calve from the stock of 10. It is also important that calving rate should be little more as 95% in case of cows which were pregnant during the year, and in buffaloes it is 90%. Number of culls must be limited, and those must be on the basis of reproductive failures. Friends, we expect all these things from cows and buffaloes, and recently I was informed that voluntary wetting period in case of cows and buffaloes is considerably reduced by 8 days to 15 days in foreign countries. So we were expecting first postpartum stress by 63rd day of calving, but in foreign countries, in dairy countries, they are expecting first stress by 45th day or 53rd day after parturition. So improvement in the targets is also important. Then only we will get this. We expect many things from the animals, but it should be linked with optimum reproduction. This reproduction in case of dairy animals is of different types, because males, they have continuous type of reproduction, whereas females, they exhibit the reproductive physiology in cyclic and phasic manner. This particular system is also not working in a unified manner, uniform manner, because the sexes are separate. The reproductive activity is dependent on many other body processes. This system and this physiology is not expected for living the life. Another important thing is that even if the system is able to work in a proper manner, it is controlled by the hormones. And most important thing is that this is the only system in the body which starts functioning late. But this late is only because of puberty, and this puberty is coined with that of the growth rate. So friends, growth, if we consider as a part of reproduction, the system starts right at the time of the birth. When we have animals and we expect optimum reproduction, we expect that these animals should settle in a very normal manner. I personally feel that once animal is in stress and when it is given an opportunity to breed, animal should conceive. On the basis of that, conception rate is the prime important thing in animal reproduction. Proportion of the cows, those are failing to return after service within 30 days, that is calculated as a conception rate. And with the first insemination, 45% animals should conceive. From the remainder stock, 50% animals should conceive. From the remainder stock, that is the third attempt, remaining 50% animals should conceive. So overall, 90% animals should conceive with the 3 maximum insemination. That is our expectation in case of dairy animals. The stress from which we expect the conception should be overt one. Signs must be pronounced one. Exhibitory stress must be there in case of animals. Simultaneously, the animal should ovulate. The most important physiological aspect is ovulation. If animal fails to ovulate, there is no use of stress. Must be fertile one. Animal should conceive after the stress. And more important thing is that the conception is dependent upon fresh egg. So every time fresh egg must be laid by the dairy cow. In case of stress, the detection of the stress is the most important thing, and that onus of heat detection is always with the owner. Owner has to detect the stress. I have studied that heat should be detected twice a daily, covering all herd animals regularly without fail. But nowadays, with the loose housing system, heat detection is not at all a problem. Animals, they are exhibiting the stress and they are also pointing out other animals which are in stress. So advances in managemental system have changed this type of criteria for heat detection. Confirmation of the stress is most important. Once we detect the stress, it should be confirmed, and veterinarian is the final authority to confirm the stress. Unless stress is confirmed, one should not go for any insemination. Now, the one who is a professional inseminator, he should have target or motto for one insemination, one conception. A veterinarian will inseminate only those cows which are perfectly fit for insemination. Veterinarian is also expected to inseminate only those cows which are regular stress, which are in regular stress. All irregular stress we have to avoid. Third important thing, very, very important, that many veterinarians, they may not like it, but always avoid first 2 to 3 pubertal stress. Their cyclicity is irregular, their physiological actions are not proper. So avoid these 2 to 3 cycle. Let animal be in the regular cyclicity and then inseminate. And the last one is that when we are considering about cows and buffaloes, always avoid first postpartum stress. This is the stress for evaluation. This is the stress for confirmation. This is the stress for checking many things, inclusive of duration of the stress, ovulation pattern, and also the type of the discharge or contents of the discharge. If we go for all those things as a prerequisite, definitely optimization of the reproduction is possible. Friends, these type of expectations are limited. Those are not expressed by the dairy animals because of infertility problems. And amongst the infertility problem, our today's topic is a burning problem. It is a hot topic. Repeat breeding. Animals, they are coming into the stress, but they are failing to become pregnant. Animals, they are exhibiting the stress, but insemination failure is leading to frustration of owner, and animals, they are expensive for the owners. As per the definition is considered, an animal which is having estrual cyclicity normal or nearly normal. This is for appearance. But the animal fails to settle even if 3 prompt services are arranged for the breeding. Such a type of animal is a repeat breeder animal. So, animal comes into the stress. Owner is providing a chance for breeding. Veterinarian is inseminating the animals. But still, there is a failure of pregnancy and frustration goes on. This is the story for many dairy animals in case of cows and buffaloes, and therefore the problem is most important for technical discussion. Friends, this is a burning problem in case of dairy animals. Maximum number of cases, maximum number of infertility cases are reported to the clinics. These animals are cyclic non-breeder animals. So we term them as cyclic non-breeder animals. Incidence is common in cows and buffaloes, but in buffaloes, incidence is little more than that of the cows. This particular infertility problem is least cared for diagnostic purposes. Whenever we have to treat a infertility problem, diagnosis and treatment. But if we miss the intermediate step of diagnosis, there is no success for treatment. And more important thing is that whenever there is a frustration with maintenance of repeat breeder animals, buffaloes are put to the slaughter. Of course, cows we cannot because of the lawful considerations, but animal owners are very much frustrated with the maintenance of the animal. Now, if we look at the national report, 50,000 crore national losses are being suffered only because of infertility problems in case of animals, and that too in dairy animals. If we count repeat breeding as a problem, since the incidence is nearly 65%, 35,000 crore rupees we are losing as an annual national loss only because of the repeat breeding. And have to calculate these type of losses on the basis of loss of the milk, loss of pregnancy, loss of calf, and also it is the maintenance cost, additional maintenance cost, and it includes even the labor and also feeding cost. So rough calculations I have given to you, but definitely the calculations are more than this, expenses are more than this, and animals, those who are carrying such a type of animals, infertile animals, they have to suffer a lot, and therefore our consideration is most important. Now this repeat breeding problem has also another facet, and it is always coined with maize, it's a type of bleeding. So there is some Indian problem for field veterinarians and also for owners. A cow which is repeating, if indicates metistus type of bleeding, then owner is disturbed and veterinary is much more disturbed. Metistus bleeding is not a common type of thing in all animals, in all dairy animals. Metistus bleeding is physiological one. It is not at all a pathological one. Metistus bleeding is normal bleeding. This particular bleeding has nothing to do with the conception. Even after metistus bleeding, animal conceives, and more important thing is that there is no treatment for metistus bleeding because it is physiological. So friends, whenever a repeat breeder cow is coined with the complaint of metistus bleeding, please remember that mate stress bleeding is normal physiological. This is seen only in case of those animals where the body score condition is perfect. Those animals which is having maximum body score condition, they bleed after stress. Now, why this bleeding occurs? It occurs only because of rupture of small veins which are present in the uterus and that too in the endometrial surface. It is because of high blood pressure during the stress, it leads to bleeding, and this blood segregates and it comes out after the stage of the stress. This bleeding occurs at a time when semen which we have deposited in the cervix and the sperms which are live and active, when they reach to the site of fertilization, that is fallopian tubes, that time bleeding occurs. Therefore, it has no relevance with whatever the events which are going on in the fallopian tube and whatever the events which are going on with that of the conceptus. So friends, please remember that mate stress bleeding is no bar, or it has nothing to do with the repeat bleeding problem. Now we are going to consider the causes of the repeat bleeding, that this particular problem is having 8% to 66% incidence throughout India. Young animals, even the pubertal animals, they suffer from repeat bleeding. Buffaloes, they suffer little more than that of the cows. But this incidence is because of many type of causes. Etiology is varied one. Multiple factors are there. It is multifactorial, and therefore the list of the repeat bleeding is unending. Friends, if we go on actual listing of total number of causes of repeat bleeding, the list will increase beyond 500. It is only because the sperm abnormalities itself will lead to 100 and 200 different type of causes. So instead of listing it, if we consider that there are problems with reproductive physiology, we will have to observe the etiology of this particular problem. So nutritional causes are more important, pathological causes are little more important, immunological aspects are also included in this etiology, and moreover our topic pertains to management. So everyone should understand that if we are not prompt enough in managing the problems, definitely there will be a repeat bleeding type of problem. Now, coming to the basic failures, why animal suffers repeat bleeding problem at field level. Number one, owners, they do not keep any type of record, and particularly that of the reproductive record of the animals. This is number one big problem. This is related with regularity of the stress. Veterinarian cannot decide whether the cycle is regular or irregular unless there are records, and therefore a written record with the animal owner is a basic failure. Number two, owner is not observing details of the stress. Owner has no information about the estrual pattern of animals. At the beginning, I said that first postpartum stress should be avoided. Why to avoid it? It is only for observations, and the observations are important for total duration of the stress. Whether animal is having 20 hours stress proper stage, whether animal is having 35 hours of total stress proper stage, or whether animal is extending the stress up to 60 hours. This is the information which needs to be given by animal owner, and therefore his observation must be perfect. This is observation number one. Observation number two from owner is related with the discharge. The type of the discharge, whether it is crystal clear, whether it is watery, whether it is thick, whether it is viscous, whether it is contaminated. whether it is carrying any type of pus cells, pus flex, whether it is carrying pussy threads, whether it is yellowish, whether it is reddish. So these minor details must be informed by the owner to the veterinarian, and that is the second failure. Third thing is that maximum number of animals are maintained with the wet, moist, soiled, unhygienic type of bias. And in animal husbandry practices, that too in modern animal husbandry practices, the first line is clean, dry, and high type of bias. Clean one, dry one, and high one. So this is the basic requirement of cow buyers, which is not fulfilled at field level. The next is the balance feeding. We have NDDB app for balancing of ration, but this particular program is not being adopted in many dairy animals. That is a big failure. Next important thing is that about the feeding practices, area specific mineral mixtures is the need of hour. This is being stressed since last 10 years in our country, but provision of area specific minerals is a problem for dairy animals. Another important problem for repeat breeding is that there is no monitoring system for artificial insemination. Technology is available, but technology is available in the hands of paravets. Technology is available in the hands of layman inseminator. Technology is uncontrolled. So unless there is a monitoring system, perfect success rate is impossible. And therefore monitoring is necessary. This is also true for source of the straw. Many companies which are not registered one, but they have production units for semen straws. This is not expected in case of scientific breeding practices in case of animals, and therefore improvement in monitoring system of AI is also necessary to control repeat breeding problem. Then the liaison of owner with that of the veterinarian is very, very important. Owner should follow the problem of repeat breeding regularly. Animal owners, they are changing the inseminators to each estrus. So this is a major problem in case of repeat breeder animals, that once animal fails to settle, immediately inseminator is changed. Immediately inseminator is changed. So that thing should not happen. A case which is presented to the clinics must be investigated, and veterinarians should strive hard for this particular purpose. Then, in case of repeat breeder animals, even there is a change in the etiology from cycle to cycle. It is important to note that animals, they may change the etiology and there may be failure of successful conception. Case which is inseminated, a case which is reported as infertility problem is not followed, or there is no follow-up for confirmation of etiology at field level. That is also a big challenge in case of repeat breeding. And the last thing is that attitude of the owners to dispose of repeat breeder animals. In case of buffaloes, no consideration. If a buffalo repeats for 4 or 5 times, owner is fully convinced to slaughter this particular animal. Why it should be? It's a prestigious dairy animal, and we can put it into the optimized reproduction if we are treating it in a proper manner. Friends, to pinpoint the etiology, we can go with clinical and laboratory investigations in case of repeat breeder animals. Clinical diagnosis depends upon checking of reproductive history. So insist every case for maintenance of a written record of date of the estrus and also duration of the estrus and also the type of the discharge animal has voided during the estrus. Attempt per rectal examination, you will find many type of etiological factors on palpation. Cervicitis. Next important thing is that the uterine feel, ovaro-basal adhesions or cyclicity pattern you can note in case of animals through per rectal examination. Of course, ovulation you can check through ultrasonography. Once we are observing the animal through clinical approach, it is possible for us to go for laboratory investigation in case of animals. And this laboratory investigation is related with estrual mucus. Check the estrual mucus for pH. Simple thing, pH can be assessed from the collected mucus. Second important point is the furning. Check the furning pattern. If furning pattern is disturbed, do not inseminate that animal. Go for metri check. This is the score method of assessing the mucus, and this will indicate whether we have to go for insemination of the case or not. Of course, we can go for blood profiling, for hemogram, and also we can go for blood biochemical estimations, particularly the phosphorus, the level of the phosphorus. That will give us the idea about the blood phosphorus level. Vaginal swab, if collected aseptically, it is useful to send it for antibiotic sensitivity test. Friends, many swabs, many type of samples we can send to the laboratory investigations, and here we will get the idea about which antibiotic is most useful for treatment in case of repeat water animals. At clinical level or at field level, it is possible to attempt white site test. Every veterinarian can attempt this particular test, and very simple type of test. Get the cervical mucus, add 3%, 5% NaOH solution to it, boil it for 1 minute, and you will find the discharge will change the color only in case of endometritis. Otherwise, this particular discharge will remain as it is. It will become whitish and it will not show any type of yellowish tinge. So the very simple test can be attempted at field level. Those who can attempt blood picture through PMN cell count, prepare the blood smear, observe it under the microscope, or whatever the discharge sample is available, make a sample out of it, smear out of it on a glass slide and observe it under the microscope. That will indicate polymorphonuclear cells. These cells are higher in number whenever there is endometritis. Criterions are there. Immediately after parturition, in normal animals, you will get more than 15 cells. In case of endometritis, the cell count will be more, up to 12 to 15. But routinely, the number is limited to 5 cells, 2 to 5 cells. That is perfectly all right picture for normal healthy estrus. And semen examination. We have semen straws provided by government stock. It is mandatory for field veterinarian to check 1 straw per month as a sample analysis for motility count. And unless we have motility count, we should not go for using of these straws. So post-thaw motility is possible in case of semen straw for analysis. Once we go for this laboratory analysis or clinical type of diagnosis, friends, classify the case. Every case must be classified into two categories. Number one, whether it is a regular stress of 21 days or whether it is a irregular stress of 22 and more days. The first criteria, first approach, managemental approach is categorize the animals into two, regular stress and irregular stress. Regular stress will indicate the animal is suffering because of failure of fertilization, or animal is suffering only because of weak type of corpus luteal development. Progesterone level is not proper in this particular animal, or even if there is conception, animal is failing to conceive only because of implantation problems. So this is the idea in case of repeat bladder animals with regular stress. With irregular stress, always we will have to keep in the mind that if the cycle length is less than 21 days, possibility of acute endometritis by day 8th up to day 12th. If animal is repeating between 8th day to 12th day, it is a possibility of acute endometritis. If animal is repeating from 13th day up to 17th day, it is a case of chronic endometritis. By observations, these type of conclusions are available for us, and we should interpret these type of cases. If the cycle length is prolonged more than 22 days, it is a definite indication that yes, animal is conceiving, but probably this particular conceptus is unable to continue the pregnancy because of early embryonic mortality. Friends, classification of the case into regular and irregular cycle is number one, but infectious and non-infectious one is most important one. Now here I have given you the criteria. On the basis of estual mucus, if discharge is transparent one, it is a non-infectious case. If the discharge is turbid one, it is a infectious endometritis case. pH of the cervical mucus, if it is limited to 6.6 to 7.4, near to neutrality, non-infectious repeat bleeding case. But if the pH is less than 6.6 or if it is more than 7.4, please remember, less than 6.6 means 6, 5.6, 5 like that. And more than 7.4, it is very common in case of repeat bladder animal, 8, 8.6 like this in case of alkaline pH in case of infectious repeat bladder animals. Metric score must be 0 for non-infectious cases, and it is always 0. But whenever there is any type of score, the case is of endometritis. It indicates appearance and odor. So 0, 1, 2, 3, these are the grades indicative of percentage of contamination of the discharge. White side test. If it is negative one, animal is non-infectious type of condition prevalent. And if the test is positive, definitely it is the case of endometritis. PMN cells, of course, we have discussed, and then sensitivity pattern. See the discharge. In case of non-infectious repeat bladder animals, delayed ovulation is a regular problem. Ovulatory defect is another problem, and untimely insemination is the third problem. So animals, they repeat only because of these major problems. And always remember that if the cycle is short, means stage of the stress, if it is short or prolonged, we will have to adjust the timing of insemination. Insemination must be in the third phase of the stress. Whenever it is a split stress, we will have to re-inseminate the animal in the second phase of the stress. When it is an infective type of stress, we will have to leave this particular stress without insemination. whenever it is a first stress as an induced stress or initiative type or beginning type of stress of a season, we will have to wait and we'll have to leave this particular stress. Superovulatory stress, when we count 2 or 3 follicles, leave this particular stress. If there are 2 to 3 dominant follicles which are ready to ovulate, let us forget about this particular stress. Irregular stress, of course, we are not going to inseminate. And false stress, only signs are present without follicle, that also stress is not fit for insemination. Friends, gestational stress is not fit for insemination, and we have to check the pregnancy in that particular case. Now, what solutions we have in case of non-infectious repeat breeding problem? Number 1 is AI management. Veterinarian should follow laws and regulations of artificial insemination. This is number 1. Number 2, improve the insemination skill, site of insemination, time of insemination. It is possible for every veterinarian to improve the skill for time of insemination and site of insemination. Inseminate only those animals which are showing perm pattern. That will also lead to maximum conception rate in case of animal. Compensate LH deficiency. The animals, repeat breeder animals with non-infectious condition, they suffer only because of luteal deficiencies, and we can compensate therapeutically this type of deficiency. Follow ovulation pattern. After insemination, every animal should be followed for confirmation of ovulation. Give luteotropic support in case of animals where there is a weak type of corpus luteum. If CL cannot be strengthened, it is possible to support progesterone. So support with the progesterone, that is exogenous progesterone, and avoid implantation failure in case of animals. What is available with us? Yes, definitely. In case of estrual stage, go for GnRH injection at the rate of 10 micrograms with AI. At the time of AI, 2.5 ml of this GnRH injection, it helps to improve the conception rate. This helps for increasing the LH level. This injection helps for ovulation. This injection also helps for management, synchronizing ovulation and insemination. Second important thing, use this GnRH on day 3rd or 5th for luteotropic effect. Luteotropic effect. CL can be strengthened by the GnRH. You can also use this GnRH on day 5th and day 12th, once again as a luteotropic. If LH is the choice for treatment, go for LH at the time of insemination. You can also use LH for luteotropic effect on day 5th. Progesterone is available in the market. Go for providing exogenous progesterone on day 7th, 10th, 13th. You can change this schedule 7th, 9th, 11th. You can go for 10th, 13th, 16th. Likewise, it is up to you to strengthen the exogenous progesterone, strengthen with exogenous progesterone for continuation of pregnancy. And the last thing, non-steroidal anti-inflammatory drugs on day 12th and day 15th of the cycle. These are also helpful. If we use them on day 12th or 15th, these type of drugs, they help to extend secretion of prostaglandins from endometrium. If endometrium is not getting any type of pregnancy CL, immediately prostaglandins are secreted, and that is a luteolytic effect. This effect is delayed by NSAID. Interferon tau, if available in the less amount, because this interferon tau is secreted by conceptus, poorly developed conceptus, poor signals of interferon tau. if those are reaching late to the endometrium, unnecessarily, many animals, they suffer from implantation failure. That can be controlled by NSAID on day 12 or day 15, and very simple intramuscular injections we can have. In case of non-infectious repeat butter animals, the master protocol is available with us. It is a GPG Owsing protocol. Start it from the day of the estrus. This will end up with the day 10th, where normally there is a second wave of follicular cycle. So this is the most useful and practicable type of protocol from day of estrus. If not, go with this protocol from day of estrus up to day 7th, 8th of the estrus, so that perfectly as per the natural cycle, you will get maximum conception rate and maximum settlements through this particular protocol. But if you use it after 10 days of the estrus cycle, the chances of success rate, efficacy of this protocol are less, and therefore this particular protocol can be used in case of non-infectious repeat butter animals. Friends, motility we have discussed, but whenever there are O'Hara-Burzell adhesions, we will have to check extent of adhesions and whether it is possible for us to go for treatment of these things. Because once there is an adhesion formation, a rupture of these adhesions, it leads to the injuries to the bursa, and therefore it is a very specific type of approach for O'Hara-Burzell adhesions with the help of drugs. Tubal blockage, if at all it is present, we can go for phenol sulfaphthalate test. Tubal insufflations is possible, where tubal patency is checked. If the tubes are blocked, it is impossible on routine basis to go for these type of tests and these type of treatment. But definitely it is possible to go for the treatment of tubal blockage at polyclinic level, and it is possible to treat such a type of animals. Non-infectious infertility is also having another facet, and that is the nutritive support. We have to support phosphorus, we have to support proteins, and we have to support fertility. So there is a direct relationship between proteins, phosphorus, vitamin A. Those are directly related with the estrus. And for that purpose, you can energize the animal after insemination. For 10 days, you can provide energy support. Direct energy support is available in the market. You can also use minerals, and you can improve the mineral status of the animals. It is possible to use bull, which is a different one. Changing of the bull can control immunoinfertility problems. So use the straw from other bulls, and that will control some of the immunoinfertility problems. But remember, in case of non-infectious repeat butter animals, never use progesterone on the day of the estrus. Thanda karne ki dawa should not be used on the day of the estrus. Progesterone is not expected in estrus cycle for treatment up to day 7th. From 0 day up to 7th, there is no role of progesterone. Similarly, there is no role of progesterone from day -19 up to day 0, where animals are returning back to the cycle. So this is also important. Whenever there is unexplained infertility, you can use herbal type of treatments, confirm firm pattern, and it is possible to go for treatment of non-infectious repeat butter animals. Major problem is related with the infectious repeat bedding, and more number of cases, 70% cases are of infectious repeat butter animals. Mixed infection is common. N number of organisms are regularly inhibited in the vaginal tract of the animals. Gram positive, gram negative, aerobic, anaerobic organisms are available in the tract, and they are leading to subclinical endometritis. And therefore, treatment of every parturited cow is necessary. Complete cleaning of uterus, healthy endometrium is necessary in case of animals at the time of postpartum stress. Otherwise, the compromised immune system, where clinical signs are absent, animal is just coming into the cycle with a turbid type of discharges, is always problematic, and it is an infectious repeat breeding problem. Friends, rectal examination cannot give any type of conclusive type of observation on rectal examination if animal is suffering from endometritis, and that too low grade endometritis. Infectious repeat breeding problem is because of organisms, infections, and listing is useless. It is only because laboratory confirmation of culture test will lead to this type of organisms which are causing the endometritis in case of animals. Expectation is that sample should be sent for antibiotic sensitivity pattern. Antibiotic sensitivity pattern is not 100% test, perfect test for providing the results to the field veterinarians. It is because antibiogram which is noted by the field veterinarian is most important. He should have a knowledge that what type of antibiotic is most befitting in the area for the treatment and control of non-specific infections. So whenever we are sending the samples, it provides opportunity. In 70-80% cases, it suggests the inhibition zones, but we should not rely totally on antibiotic sensitivity testing. It is necessary, but clinical judgment of veterinarian is most important. Uterus acts as an incubator because it is moist, it is dark, it is warm, it is sterile, it provides the nutrients, and it is also providing the nutrients. So organisms, they prefer uterus. Organisms, they settle in the uterus. Organisms, they are resistant to go away from the uterus, and therefore regularly the mixed type of infections are seen in case of uterus. Very minute type of vaginal discharges, pus coming from cervix, pus coming from uterus is a common observation in case of repeat breeder animals. Remember, this infection will not kill the organism. This will not create any type of major problem in case of animals, but maintenance cost of these repeat breeder animals is very, very high, and it is most expensive for the owners, and therefore we have to take care of infectious repeat breeder animals. Those non-specific infections are most importantly opportunistic one. Those are wound invaders. Those are available everywhere in the universe. This is environmental infections. Those are influenced by perpetuating or predisposing causes. Whenever there is a stress, infection will flourish. Individual animal is only affected by this infection. Other animals are healthy and normal. Lateral or horizontal transmissions are possible by these infections. Transient and self-limiting is the character of this type of infection. There is no severe genital infection because of this type of non-specific infection. Endometritis with only turbid discharge is the common observation. It leads to contamination, elimination, and repeated contamination of the animal. Problem is that they are reducing the reproductive efficiency in case of animals. What are the effects of these organisms? They lead to uterine inflammation, denudation of endometrial mucosa, Secretory activity is increased in case of animals. Uterine environment, particularly pH, is altered. It becomes more alkaline. There is a production of bacterial toxins, and those are detrimental for the sperms and the gametes. They release irritating type of histamine-like substances. Continuously animal is straining. These are not observable type of straining, but uterus is continuously straining, and pussy type of discharge because of the tissue damages is observed. Fertility is influenced by very many means, and animal is suffering. Proper control for the infection is through uterine defense mechanism. Body has a system. Antibiotics is a different type of story, but body has a system to go for defense against this type of pathogens. Leukocytic infiltration, uterine contractions, secretions, immunoglobulins, all these things, they are attacking on available infection, and then there is a limiting of this infection. The first defense to infection is innate immunity. Whatever is available in the body, that immunity fights against the infection. Cellular components are cells, and more important, those are macrophages. Molecular components are mucins, defensin, and lactoferrins. Those are more important to fight against the infection. Friends, stress is controlled by hormones, steroidal hormones, estrogen and progesterone, of which progesterone is the best friend of infection. Progesterone flourishes the infection, whereas estrogens, they limit the infections. And therefore, uterine epithelial permeability to bacteria is reduced. The luteotypic response is delayed in case of progesterone phase, and therefore infection is always flourished during the digest stage. It is necessary to control this type of infection before ovulation. So in case of repeat bleeding, it is always recommended that control the infection before ovulation and not after. Now, what type of drug we should select for treatment of infectious repeat bleeding? Number one, it should eliminate the microorganisms. The therapy should not affect uterine defense mechanism. The therapy should not be irritant to the endometrium. The therapy should not adulterate the milk. It is also important that this drug should not lead to antibiotic resistance. Drugs should not be used indiscriminately unless and until we are giving our professional skills for implementation of the therapy. No drug should be selected. Whether it is to be used by intrauterine or parenteral therapy, that is always a controversial problem. No. Merit of the case is more important. If the case is subclinical endometritis, you can go for parenteral therapy. But if there is a moderate type of infection, you will have to go for intrauterine therapy in some of the cases. The first line of the treatment in case of infectious repeat bladder is antiseptics and antibiotics. Antiseptics is number one, where irritational effect of the antiseptics is possible to reduce the infection. The second one, we can also use the hormones on day 12th of the cycle. If we use prostaglandins, we can cut out the cycle length and we can discharge uterine contents. So infection we are limiting with the help of prostaglandins. We can also use herbal type of drugs where the action of these herbal medicine is ecbolic or to cure the uterus. Uterine curative type of approach we can have with the herbal drugs and combination treatment. When we select antibiotic, broad spectrum antibiotic, we will have to check what type of antibiotic we have selected and whether it will cover the control on total infection, aerobic and anaerobic. So such a type of consideration is necessary in the treatment. Treatment is also possible with immunostimulation of the body for strengthening of body immunity. But it is possible nowadays to use immunomodulation as approach to improve the uterine defense mechanism. Instead of antibiotics, go for immunomodulation. That will help to limit the infection, that will not irritate the endometrium, and that will be useful for controlling the infection. Of course, alternatives to the antibiotics are available through herbal antibiotics and in human even treatments, neem, garlic and turmeric. Prime important, most commonly used type of herbal antibiotics are neem, garlic and turmeric. Their rampant use in case of animals is necessary because there is no resistance for this type of drugs, and most important thing is that they have profound effect to control maximum infections in case of animals. Of course, Triadex, Pongamia and so many other things are available even in this traditional knowledge. But if we go for these treatment, definitely it is useful. Now, I have attempted some type of experimentation in case of animals, and with our postgraduate students, we observed many things about the treatment in case of infectious and non-infectious type of repeat predators. Friends, the first experimentation, if you find, in case of crossbred cows, we found that nearly 64% cases were suffering from endometritis, and level of mild to moderate was 34%. Crossbred cows, repeat breeder cows with no infection can be very well treated with the GnRH or even Osing protocol most effectively. So this is our observation in case of crossbred repeat breeder cows. In case of repeat breeder cows, we have also observed that it is possible to go for antibiotic treatment consisting of enrofloxacin intramuscularly and metronidazole intravenously. It gives best results with 91.67% success rate in case of cows and 83.33% conception in case of cows. So recovery rate is 91% and conception is 83%. So this is a combination treatment. Likewise, there are n number of combinations. Cycle break with prostaglandin after complete antibiotic treatment. When animal is repeat breeder, on day 10th to 12th, use prostaglandins. Animal will come into the stress within 2 days. Use complete antibiotic therapy and then go for insemination to the next cycle. This is the useful type of approach for treating the cases. Now, in case of in the second experiment, we have attempted this in case of buffaloes, and it was observed that yes, buffaloes, they do have infections, but severe infection is always less. It is only limited to 8%. We have observed maximum 52% cases of endometritis with mild to moderate type of infection. In case of buffaloes with non-infectious category, GnRH protocol has given 75% success rate. With Osing protocol, the success rate was 66.67%. When combination treatment was used in case of infectious repeat breeder buffaloes, you will find that 58% conceptions we could get in case of buffaloes with the recovery rate at 67%. Even in case of buffaloes, if we go for cycle break and antibiotic therapy, infectious repeat breeder buffaloes can show pregnancy rate at 91.75%. So this is also important to note that if the type of antibiotics is perfect, and if it is in combination, it gives best results. In case of cows, we observed that Lugol's iodine working solution 4%. It has best recovery rate still. In case of cows, we can go for 4% Lugol's working solution. In buffaloes, it gives up to 57% recovery rate, and we can have best conception rate at 63% in cows and 57% in case of buffaloes. Immunomodulation, I was talking about, when we have experienced this particular drug, we found that this is going to give us 71% conception rate in case of cows and 83% in case of buffaloes. Then immunomodulator E. coli LPS was used with a limited dose rate of 100 micrograms. If we use it up to 300 micrograms, definitely it will improve to the maximum extent. When we are using immunostimulants along with the E. coli as an immunomodulator, definitely 100% response of recovery rate was seen in case of cows, and it was increased to 87% in case of buffaloes. These are all postgraduate research outputs of this institute. In the another experiment, we have observed that PMN cell counts are 15% in case of cows, or 15 cell count in case of cows, 17 cells in case of buffaloes. Neem extract we have tried in case of animals, and yes, 55% and 44% pregnancy rates we have achieved, means the recovery rate is little more than that. When E. coli alone was used in case of cows, it has showed 77% conception rate in cows and buffaloes. Simultaneously, use of immunostimulant has once again improved recovery rate and conception rate, even in case of buffaloes, just like that of the cows, which we have discussed in experimentation number 3. Number 5th experimentation is also on the same, where we have used neem extract with ashwagandha powder orally. And here also we have got the 66% consumption rate and 55% pregnancy rate in case of animals. Of course, the observation in other animals and other treatment groups for immunomodulators are the same for Lugol and also for E. coli polysaccharide. In a departmental research work, we have observed levofloxacin and alpha tocopherol. It gives 86% response in case of cows and 75% response in case of buffaloes. Then we have used combination treatment. When Dr. Mule was with me for clinical cases, this alpha tocopherol is the best supplement which acts as a cellular antioxidant, and also it favors for improving uterine defense mechanism, where 90% recovery of cows and 83% recovery of buffaloes has been evaluated. Now friends, ozone therapy, you are more interested in this particular treatment. See, this is the type of the instrument, and you will find that this particular therapy is alternative to antibiotic therapy. Ozone is oxygen. It is oxygen therapy. Making the environment aerobic is most important to limit the infection. And for that purpose, it is an alternative system in medicine. Ozone therapy is an available type of system in the medicine to increase oxygen level to each body cell. And that is possible in case of endometritis. Ozone, it acts as an immunomodulator. Whatever we have achieved with oyster glycogen, autologous plasma, or with E. coli polysaccharide, the same thing can be achieved with ozone therapy. Whenever we are infusing oxygen, definitely it will include uterine defense mechanism, because ozone acts as a bioregulator and it shows antibacterial effect. Moreover, ozone exhibits multiple reactions and effect such as antioxidant, immunostimulant, pathogen inactivation, vascular and hematological modulation. It is an anti-cancer type of approach, and most important thing is that it has anti-inflammatory action. In all infectious reproducible animals, all veterinarians do think about infection, but they never think about inflammation. Unless inflammatory condition is reduced to normal healthy type, no animal is going to conceive even after removal of infection. And therefore, once you treat the animal, provide some rest, provide a cycle rest, and then go for artificial insemination. So healthy endometrium, normal endometrium, uninflamed endometrium is necessary in case of repeat birth animals. So if we go with this particular approach, it is possible for us to have successful conceptions. Friends, insemination in case of repeat birth animals is limited to estual stage in dairy animal. Whenever you are going to inseminate only during estrus proper. But estrus has no limit for expression. Estrus can be exhibited on day 2nd, day 3rd, day 4th, day 5th. Likewise, this is the list up to 120 days. Entire listing. Animal was in estrus on day 0, followed by day 1, day 2, day 3, day 4. You can have the list and you will find that there are many pathological type of conditions, many altered conditions where animal has repeated type of estrus. Animals are cycling on various days, leading to irregularity in the estrus, and these animals are not fit for artificial insemination. I have tried to include the list from day 1 up to day 120, that is up to gestational estrus, that how we can approach in these type of animals. Animals, they have a complaint that repeat breeding infertility problem is continued since last 4 months, 5 months, 6 months, and because of repeat breeding, owner is not managing well. So who is the sufferer? Is the animal. Of course, owner has to suffer. But a perfect veterinarian can take up this particular challenge and he can make the animal pregnant. So in case of repeat breeding problem, if veterinary team insists for perfect approach and modern type of tools of investigation of etiology, I'm confident that 75% repeat breeder animals can be resolved very easily. Nation will have double influx of milk, and that will be helpful for us. See, dry cow buyers has no alternative. Wet cow buyers will lead to endometritis and it will lead to repeat breeding problem. Provide dry buyers, insist dry buyers, and that will resolve our problem a lot. If case comes, we are trained enough, we have maximum approaches to treat it, and thus it is possible for we all to control the repeat breeding problem. Friends, I have discussed this particular repeat breeding problem in detail with you all, and all PowerPoint presentations are available for you to use and extend to your friends. Thank you very much. Let us go for some of the questions also. I will request Dr. Kumawat sir to provide me some of the questions so that we can answer for some of the queries. Sir, please. Right. Mohit Mahajan, Dr. Saab, he has asked how we should proceed for repeat breeding in case of sheep and goats. Small ruminants are of course there. Yes, definitely. If we will have to first classify the animal, regular or irregular cycle, and number 2, infectious or non-infectious. And the line of the approach, doctor, will be the same in both large ruminants and small ruminants. Reasons and treatment for watery discharge during estrus. Dr. Haresh Saab is asking regarding the watery type of discharge. Generally, FMD is the problem which leads to more secretory activity of the endometrium. Those animals which are having maximum secretory activity, they show watery type of discharge. This is also because of phosphorus deficiency. So tonoracine will take care of such a type of animals, and tonoracine is not only providing the phosphorus, but it is providing energy blocks. So definitely this particular system will help in case of repeat breeder animals. Dr. Saurabhji Sharma is asking about Metricheck system. Metricheck system is the system where we are getting the endometrial fluid and we are assessing it on physically for the confirmation characters of the discharge, and 0 is grade where transparent type of discharge is available. 1 grade is given where some smell is imparted to this particular discharge, and few type of whitish contaminants are available in the discharge. When the discharge is carrying 50% type of whitish part, it is a Metricheck score 2, and when complete discharge is totally whitish, it is the grade 3. Professor Krishna Murthy is asking about the volume of 5% NaOH and the discharge for white side test. White side test is a simple test. Equal parts, those are to be taken, whatever the contents we are taking. There is an article that cervical discharge or uterine content, they have similar properties because it is the same type of discharge which is coming from uterus, cervix, vagina in case of estual animal. So get the discharge in equal quantity, use 5% NaOH solution, add it in this discharge, boil it for a minute or two, and you will get the precipitate. If it is colored one, yellowish one, it is endometritis, otherwise it is not. Dr. Amitji Khajuria are with us, he is with us, and he is asking about sometimes ovaries are non-pathological, that is absence of follicular cyst, even though some animal comes into the stress after 4 or 5 days after the first stress. What should be the normal insemination time in such cases? Friends, our criteria is perfect. Open cervix, tonicity of the uterus, and follicular availability, premature dominant follicle which is ready for ovulation, only one that should be available on the ovary. And once we inseminate such a type of animals, the second chance for insemination is always after 21 days, not within 21 days. So that should be the criteria. How we should use neem extract, turmeric extract for uterine root? Dr. Rajat has asked this question. Friends, herbal antibiotics are now available in the market. Neem extract is available in the market. Only thing is that it should not carry oil base. The oil base, the retention is more, and it is leading to irritation to the endometrium. Otherwise, aqueous type of this extracts of turmeric, garlic, and the neem, those are very, very useful in case of animals, and it gives up to 50% response. Dr. Manjunath is there, and he is asking about GPG protocol gives good results when it is initiated on 4th day of this. Of course, fine, no problem. Start it either from day 0 up to day 10th on any day, you will get best results. But if you start it after 12th day of the cycle, you will get limited type of results in case of non-infectious repeat breeder animals. What is the relationship with mastitis and repeat breeding? See, endometritis and the mastitis, they have a definite relationship. Subclinical endometritis and subclinical mastitis, these are the best friends of each other. And therefore, whenever there is a type of infected discharge from the endometrium, it has to go, or it will go definitely to the udder, and there will be definitely a problem. What is the normal pH of estual mucus? Friends, normal pH is neutral. It is 6.6 to 7, maximum 7 to 7.4. This should be more closer to 7. 6.8, 7, 7.2. This is acceptable. When it is more acidic or alkaline, we have to leave that particular case. There is a question from Kuman. Doctor, what are the field gynecological conditions where uterine washing is indicated? No, we are not going to wash any type of uterus. We are going to infuse the uterus with antibiotics or antiseptics. Washing, it will lead to a type of retention of some fluid, and that can lead to infection. Sir, is the problem hormone trigger or reproductive performance in high yielder animals? As high yielders, we are more prone to be a repeat breeder. No, fertility and productivity, they go hand in hand. If animals are productive, we have to supplement them with proper nutritional status. And the cows which are yielding 45 liters of milk on an average in Australia, they are expecting pregnancies or first estrus by 45th day of calving. See, we will have to achieve this type of targets even in India, because there are potential dairy owners in India under startup scheme, and we have to think in that particular manner that productivity and fertility should go hand in hand. There is another question from Dr. Subramaniam. Is there any change in the behavior and expression of the estrus signs between natural and PG induced estrus in case of animals? There should not be any type of difference in that, because basic criteria to initiate the estrus is the same in both. And number two, the signs, they depend upon the level of the estrogen. Then another important thing is that the male estrus breeding results in conception is a myth or reality. I have emphasized this, that it is always a myth to consider about mate-estrus breeding. Mate-estrus breeding has nothing to do with the repeat breeding problem or conception. And GPG protocol is not more suitable in case of heifers, but we can go for GP protocol. It is a selecting protocol. So GnRH and prostaglandin, that particular protocol is more useful in case of animals. Please comment on a treatment of kinked type of the cervix. Kinked, it should be kinked cervix. Dr. Rasim Saab, the thing is that when the cervix is kinked one, when it has a different type of orientation, it is possible either manually to hold the cervix at the time of insemination for proper insemination of the gun. Gun is to be entered up to mid-cervical level only. Or if there is a much hardening of the cervix, we can go for treatment of valethamite bromide, that is epidocin, a day before the cycle, so that flexibility of the cervix can be improved to some extent. Then there is one question from Dr. Rishi Gupta. Which intrauterine is most effective? Not getting satisfactory results with intrauterine preparations available in the market, and want to know about Metrisafe in response. Number of companies, they have number of preparations. Haphazardly, no drug should be selected for the treatment. Antibiogram and assessment of antibiogram is the major responsibility of the field veterinarian. He should first assess that which type of infection is prevalent and which type of antibiotics are more useful. So that will clarify the answer of selecting the antibiotic in case of repeat breeder type of animals. Dr. Manoj Kumar Chaudhary ji is also with us. He's asking about what is the perfect timing of insemination in case of nymphomanic animal, or treatment is required first. Yes, definitely. Treatment is required in case of nymphomanic animal, and treatment is none other than, once again, the selecting protocol or GP protocol, Gyneric on day first, or the GnRH treatment on day first, and on day 7 the prostaglandins. But insemination is always in the third phase of the estrus. So that is a most important thing. Friends, number of queries are getting increased, and it will be more appropriate to have detailed answers for this. And I am committed to answer every query through email. So my email address, please note down, which is available on the last slide. And definitely we will meet for all technical type of discussions. Our discussions should continue regularly so that we can provide best services at field level. So this was from my side, and I thank you very much once again to whole team of Vetaconol for giving me this opportunity for this presentation, which is more related with the field veterinarians. And it was not possible to complete me this assignment without the support and the technical support provided by Dr. Kumawat. So he is always associated with me for this type of technical deliberation. Thank you. Thank you very much.
Thank you, sir. Thank you for this elaborative and wonderful discussion on this burning topic, repeat breeding. Definitely, it is a big challenge for the dairy industry. And you explained this topic in a very simple way, sir. And I'm sure that the participant must have received a very simple and approaches how to manage this problem. Sir, you also describe about the various approaches in diagnosis and therapeutic management of repeat breeding in cattle and buffalo. And definitely this knowledge is useful for the participant who attended this seminar, both on the Zoom webinar as well as those participants who are there on the Facebook live page. There are many questions. I think there are 80-90 questions which has came to us, and there are also questions on the Facebook live. Sir, we'll compile these questions and send it to you, and definitely, sir, you will answer that questions of all the field veterinarians and the participants which are there in this program. Once again, thanking you, sir. Now I will request Mr. Anjan Kumar Das, Deputy General Manager of Vetaconol India, to present the vote of thanks. And I also thanks Dr. Kumawat for nicely compilation of all the. Dr. Kumawat, can you show your okay
presence?
Yeah. So Dr. Kumawat, thank you so much for the nice compilation of all the data. And definitely, as Markandeya sir has told you, that with your support, we could do it well. Thank you so much, sir. It was a very wonderful presentation, and definitely we'll continue this type of session in going future also. Now, Dasab, now over to you.
Yeah. Namaste. So, in behalf of Vetaconol, we thanks to Dr. Niteen Markandeya sir, and who was our speaker for the day. And it was a very elaborated session, and looking to the type of question, number of question, and the quality of the question, it shows that in the audience was having so much of interest. And definitely, as Dr. Vijay has mentioned, that we will all answer all questions. And we once again thank you, sir, for your valuable time on a holiday. And Dr. Kumawat, we also thank you for your support, and to Dr. Niteen Markandeya sir. And we also extend our sincere thanks to all audience, those who have taken their time on a very Sunday, that is a holiday, and attended the webinar for more than 1.5 hours. And not only that, they are fully participation by asking the question, the quality of the question. It clearly shows that all of your participation was so nice. So thank you once again to all the audience. And I thanks to our Managing Director, Mr. Gautam Chattai sir, for his encouragement and inspiration for conducting today's webinar. And it was his inspirations, and we conducted this webinar. And I must extend my sincere thanks to all my marketing team and sales team members for extending their support, contribution to the conducting this webinar so effectively. And we will definitely once again thank you to all of you, and stay safe and stay healthy. Namaste.
Thank you. Thank you. Thank you, sir. Thank you.